Hey guys, it's Miss Reyes and Miss Ratcliffe, and today we're going to be going over your IV initiation and DCing.
All right, so please remember you have to have an order to start an IV and an order to DC it. We always need to verify our patient and provide privacy, check for any allergies or contraindications. We're always going to gather our supplies, so you're definitely going to need an IV start kit. You're going to need an IV cannula. Bringing 2 to the bedside is always good in case you need to stick your patient again. You need your extension tubing and a flush. So you're going to enter your patient's room. Make sure you identify your patient and wash your hands. So now we're going to prepare our supplies. So Miss Reyes is going to open up all of her supplies, making sure that they're not soiled and they look good and they're not expired. She's also going to open up the extension set and flush it and take the cap off. And this is super important because you have to have this ready in order to start your IV. So see that little cap right there? That is what is actually going to connect to your IV. So make sure you don't contaminate that, and we're going to flush it. Okay, so it's flushed, and now she's going to set that back inside of that tray to where it is nice and clean and is not sitting on the bedside table. If you need to get any tape ready, you can do that now. So make sure that you have your equipment working for you. Raise your bed to a comfortable position. If you need to put a towel under your patient's arm, you can. Miss Reyes is also going to don gloves. She's now going to look for her vein, applying the tourniquet with the quick release method. So some things you can do to help make your veins pop: warm compression, dangling the extremity, making sure your tourniquet's on correctly. So it's very important that you find the vein before you decide to stick. All right, so she's gonna take her tourniquet off, and now she's gonna clean the site. So once you've cleaned the site, you need to make sure that you're not contaminating that site. So clean the site and reapply the tourniquet. Again, at this point, making sure all of your supplies are exactly where you want them because you're about to lose one of your hands. Okay, she has her tourniquet on. Now she's gonna go ahead and get her IV needle and take the cap off. She's going to make sure the bevel is up. For deeper veins, we stick at 30 to 45 degree angle. For shallower veins, we stick at a 15. I'm gonna move in real fast. Okay, so once you go in for your stick, you're gonna immediately be looking for a flash so you can know that you're actually in the vein. So if y'all look, Miss Reyes has a flash right there. So once you have your flash, you're not gonna insert your needle anymore. You're only gonna insert the cannula. So you're gonna push the cannula in while pulling the needle out. You heard that click. So once you get to this point, you're gonna hold your IV cannula and you're gonna release your tourniquet. Okay, now she's gotta have her extension tubing ready because she's gotta stop that bleeding. You can compress the vein, but please don't put your fingers over the insertion site. Once you've got that on, we're gonna do a quick flush and look for swelling. Make sure it flushes well. Looks good. Okay. So making sure again that you're not touching that insertion site. We're gonna clean it up a little bit and apply our Tegaderm dressing over our insertion site. So make sure you put your initials and the time and date that it was put on, and also make sure you tape it down really good so you don't lose your IV because your patient's probably going to be getting up and going to the bathroom and pulling on it. A lot of students have questions on how to secure it. I like to secure it in 1 or 2 places. especially on that extension tubing set.
I usually go wherever your IV pump is going to be. So say the pump is going this way, then you'll have your extension set going this way so the line can come to it.
Always ensure that your line is clamped before you take your flush off, and her IV is done. Clean that arm up. All right, okay. So you always want to make sure that you're assessing your IV site when you go into your patient's room. You're looking for redness or swelling at the insertion site, also checking for phlebitis. You also want to check and make sure that you don't have an infiltrate if they have IV fluids going, which would mean that the arm was swollen and it can be cool to the touch, so always doing that assessment. We're also going to document and make sure that we have talked about the IV gauge that we have inserted, how many sticks, how well the patient tolerated, what kind of dressing we put on, what we flushed with, that we used aseptic technique, and make sure you have all that correct. All right, so now we're going to discontinue our IV. So make sure you have an order for this. You're going to need a 2x2 gauze, possibly an alcohol wipe to help you get that tape off, and you're going to need some exam gloves. So Ms. Reyes is going to go ahead and apply gloves, wash your hands. If you do have IV fluids running, you need to turn your pump off and clamp the tubing. All right, so I'm going to zoom in a little bit. So on your elderly patients, be careful. You can rip their skin. Ms. Reyes has her 2x2 ready to go. So you can use the alcohol to help release the Tegaderm dressing so we're not ripping or pulling on our patient's skin or the tape. So you're going to remove the dressing towards the insertion site so you're not pulling on it or anything like that.
I kind of like to come up off on the sides, and I always hold it, especially on these mannequin arms. It's just because it's so hard to get it off. So you can see your instructors struggle with this. Don't be scared if you struggle with it too. It's just the mannequin arms. So we're doing like a push-pull method. And I'm holding on and keeping this in place so I don't just rip it out.
So once Ms. Reyes has all of the Tegaderm dressing off, then she's going to get her 2x2 ready, place it over the insertion site.
I know it's hard to see, I'm sorry y'all.
It's all right. And remove the cannula. Once she's removed the cannula, she's going to put gentle pressure on the patient's arm, and she's also inspecting that cannula to make sure it is completely intact. So we're holding pressure, making sure that we're stopping bleeding, and we might put some tape over it. If you have someone on anticoagulants, you may need to hold pressure for longer. So we're going to apply our bandage, dispose of our tubing and our cannula in our sharps container because there's blood in it, and then we're going to document. Please let us know if you have any questions. Y'all have a wonderful day.